So right now what I'm going to do first, I'm going to prime the tubing and have it prepared whenever I start the IV. So here's my bag. I'm going to unplug it. And I'm going to take my cap off of the tubing, and this is sterile, so if I drop it or if I touch it on anything, I'm going to have to get new tubing. So I'm going to spike the bag, make sure I don't poke through the bag. And I'm going to turn it over, I'm going to hang it, and I'm going to squeeze this little chamber here until it's 2/3 or a half full. So that right there is good. And I'm going to go ahead and unclamp it and make sure that all the air bubbles are out whenever I'm doing this.
For the sake of the video, you're not supposed to do it. You're supposed to let it air dry. Alright, so let's begin. I found it.
So I'm going to do it over a trash can. Like I said, making sure that all the air bubbles are out. And whenever you hang it, the higher you hang it, the faster it's going to flow.
Over here. Blood.
And so I'll get my tubing primed.
Human pressure.
Okay, so now I'm actually going to start an IV. The first thing I'm going to do is I'm going to enter the patient's room, knock, knock, knock. Hi, my name's Dusty. I'm going to be your student nurse today. I'm going to explain to them that I'm going to be starting an IV on them, and I'm going to explain to them why and some just different things about IV initiation. I'm going to go ahead and pick the site and turn it with their arm. And the best site to start is going to be as distal as possible. But for video purposes, I'm going to be starting on the chunk arm, so I'm going to go ahead and turn against them. I'm going to feel
now it's time to tape.
a good vein.
I'm going to do the U method.
And after I do that, I'm going to go ahead and let the tourniquet go. I'm going to get everything ready, so I'm going to go ahead and prime my saline lock. I have to put the hub on and prime it as well because it's got air in it. So I'm going to go ahead and perform hand hygiene and get my gloves on. And
just keep it from falling out. There's the U. You can use the crossover.
so whenever I'm talking about the needle, the smallest you can have for blood is 20 gauge. And we usually use 18, 20 gauge is what we really use.
I have my date right here on it.
I'm going to now clean off my site.
There we go. And before I would have introduced myself.
I'm going to break this away from me.
Told the 6 rights.
I'm going to go
for doing it, check everything.
Side to side, up and down, and around for about 30 seconds, and I'm going to let it air dry. This is going to go in the sharps container since it's glass. And of course, like I said, I would let it air dry, but since the chunk arm doesn't air dry, I'm going to go ahead and wipe it off. Like I said, on a real patient, I would let it air dry. So then I'm going to get everything ready. I'm going to go ahead and put their tourniquet back on.
Classic rookie YouTuber.
I'm going to get my needle ready. I don't want to feel, after I've cleaned, I don't want to feel for their vein again, but if I do have to, I'm going to put alcohol on my glove. That way I try to maintain sterility. So, I'll get ready to start my IV. I'm going to make sure and anchor the vein. I'm going to go in fast, and then I'm going to advance the cath. Whenever I see flashback, I'm going to go ahead and take the tourniquet off. And I'm going to go ahead and advance the catheter. I'm going to go ahead and put the safety on. I'm going to apply pressure to the vein as I take the needle out. I'm going to put the saline lock on. And flush. I'm going squirting over here. Okay? And after I flushed, I can go ahead and take the saline lock off. And I'm going to go ahead and hook up my... Oh no, I'm going to tape it first. Just kidding. I would normally have my tape ready. There's some tape still on the table. Okay. She's wonderful and got tape for me. So, I'm going to go ahead and tape. And I'll tape over. I want to make sure I don't want to put tape right on the site. And I'm going to use my little dressing here. I'm going to put my initials, date, gauge of needle, time, and then I'm going to go ahead and put this over it. And take the white part off. And I'm going to take my little time and date and put it on there. And then, like I said, I'm going to go ahead and hook up. I'm going to take my cap off, hook it up right in here. And I'm going to go ahead and calculate my drip rate and everything and go ahead and start it. Let's see if it works. Oh, it's thinking about it. Yay! Drip, drip. Drip, drip, drip. Yay! Ivy started.